Rifamycin Tablet, delayed release, Enteric Coated, is a medication used to treat diarrhea caused by E. coli bacteria, also known as traveler's diarrhea. It works by stopping the growth of bacteria. It is important to note that this medication only treats bacterial infections and will not work for viral infections like the common cold or flu. Using this antibiotic when it is not needed can cause it to not work for future infections. It is also important to not use this medication if you have a fever or bloody diarrhea. The recommended dosage and timing for this medication should be determined by a healthcare professional. When taking Rifamycin Tablet, delayed release, Enteric Coated, make sure to follow your doctor's instructions. Typically, you will take this medication twice a day for 3 days, in the morning and evening. Swallow the tablets whole with a glass of liquid, and do not take it with alcohol. It's important not to crush, break, or chew the tablets, as this can release all of the drug at once, increasing the risk of side effects. The dosage will be based on your medical condition and how you respond to the treatment. To get the best results, take this antibiotic at the same times every day. This will help you remember to take it consistently. Even if your symptoms go away after a few days, continue taking the medication until you have finished the full prescribed amount. Stopping the medication too early may cause the infection to return. If you experience a fever, bloody diarrhea, or if your condition does not improve or worsens after 2 days, be sure to notify your doctor. This medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. However, this medication may rarely cause a severe intestinal condition due to a bacteria called C. difficile. This condition may occur during treatment or weeks to months after treatment has stopped. Tell your doctor right away if you develop diarrhea that doesn't stop, abdominal or stomach pain/cramping, blood/mucus in your stool. If you have these symptoms, do not use anti-diarrhea or opioid products because they may make symptoms worse. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed, contact your doctor or pharmacist. If you experience any side effects, it's important to consult your doctor for medical advice. They can help you manage any symptoms and ensure your safety while taking this medication. Before taking rifamycin, it's important to let your doctor or pharmacist know if you have any allergies to rifamycins or any other ingredients in the medication. Make sure to also discuss your medical history with them before using this medication. Rifamycin may affect the effectiveness of live bacterial vaccines, so it's important to inform your healthcare professional if you are using rifamycin before getting any immunizations. If you are planning to have surgery, make sure to inform your doctor or dentist about all the medications and herbal products you are using. If you are pregnant, rifamycin should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. It's not known if rifamycin passes into breast milk, so consult your doctor before breastfeeding if you are using this medication. When taking Rifamycin Tablet, delayed release, Enteric Coated, it's important to be aware of potential drug interactions. This medication may affect how other medications work or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the safe and effective use of Rifamycin Tablet, delayed release, Enteric Coated, along with any other medications you may be taking. As always, consult with your healthcare provider for personalized advice. If someone has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Remember, always take medication as prescribed by your doctor. Rifamycin Tablet, delayed release, Enteric Coated, is used to treat certain bacterial infections. It works by stopping the growth of bacteria. Take this medication by mouth with or without food, usually every 12 hours, or as directed by your doctor. The dosage is based on your medical condition and response to treatment. Remember to take it at the same times each day. Do not share this medication with others and only use it for the condition it was prescribed for. If you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. Make sure to store Rifamycin tablets at room temperature, away from light and moisture. It's important to keep them in a safe place, away from children and pets. When it comes to disposing of this medication, make sure not to flush it down the toilet or pour it into a drain unless instructed to do so. If you have any questions about proper disposal, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.